Think of your body as a city. Every cell is like a tiny house that needs glucose, sugar, for energy. But sugar can't enter the house by itself. It needs a key. That key is called insulin. In diabetes, either the body doesn't make enough insulin or insulin stops working properly. As a result, sugar stays in the blood instead of entering the cells. And that's when problems begin. How does a diabetic patient present? 1. Frequent urination, polyuria. The kidneys try to remove the extra sugar, and sugar pulls water with it. So the person keeps running to the bathroom. Bathroom again? Yes, again. 2. Weight loss. Even though there's lots of sugar in the blood, the cells can't use it. So the body starts burning fat and muscles for energy. Result? Weight loss.
4. Blurred vision. High sugar changes the amount of fluid inside the eye. Vision becomes blurry. Sometimes people simply think, maybe I need new glasses. But diabetes could be the real reason. 4. Tingling or numbness, paresthesia. Ever had your foot fall asleep? Diabetes can damage nerves. This causes tingling, pins and needles, or loss of sensation in hands and feet. 5. Ketoacidosis. Sometimes, especially in type 1 diabetes, the body burns too much fat. This produces chemicals called ketones. Too many ketones make the blood acidic. This condition is called diabetic ketoacidosis. It is a medical emergency and needs immediate treatment. 6. Weakness. Even with plenty of sugar in the blood, the cells are starving. That's why many diabetic patients feel tired and weak.
How do doctors diagnose diabetes? Doctors use a few simple tests. Fasting blood sugar. After fasting for about 8 hours, blood sugar is checked. Random blood sugar. Blood sugar can be checked at any time of the day. Glucose tolerance test. Here, you drink a sugary drink. Then doctors measure how your body handles that sugar over time. HbA1c test. This is one of the most useful tests. Instead of showing today's sugar, it tells the average blood sugar over the last 2 to 3 months. Think of it as your body's sugar report card.
What happens if diabetes isn't controlled? Ignoring diabetes is like ignoring a small leak in your roof. Eventually, the whole house gets damaged. Some common complications include frequent infections. High sugar helps germs grow. Cuts and wounds also heal more slowly. Eye problems. Diabetes can damage the tiny blood vessels in the eyes. Over time, vision may become poor. Diabetic foot. Because nerves lose sensation, people may not notice small cuts. Poor blood supply makes healing slower. That's why proper foot care is extremely important. Heart attack. High blood sugar damages blood vessels. This increases the risk of heart attacks and strokes. How is diabetes treated? Treating diabetes isn't just about medicine. It's a team effort. Healthy diet. Choose foods low in added sugar. Eat balanced meals. Include vegetables, whole grains, lean protein, and healthy fats. Healthy eating helps keep blood sugar under control. Exercise. Exercise makes insulin work better. Even a daily walk can make a big difference. People with a family history of diabetes should stay active and maintain a healthy lifestyle. Diabetes medicines. Some people control diabetes with tablets that lower blood sugar. Always take medicines exactly as prescribed. Insulin. Some patients, especially those with type 1 diabetes, need insulin injections because their body doesn't produce enough insulin. Diet tips.
Doctors often recommend controlling total calories based on a person's age, weight, and activity level. A balanced diet generally includes carbohydrates, about 50 to 55% of calories, fats, around 30 to 35, protein, about 10 to 15%. Protein intake is often around 60 to 140 grams per day, depending on individual needs. Carbohydrates may range from 100 to 300 grams per day, based on the person's calorie requirements. Try to keep salt below 6 grams per day. And don't forget, eat more fiber-rich foods like vegetables, fruits, legumes, and whole grains.
Like, share, and subscribe Thera.